Hi friends, evening. I am Dr. Ashutosh Gupta. I am a consultant in fetal medicine. So today we are going to talk about fetal kidneys, right? So kidneys के होने ना होने के अलावा किडनीज के होने के बावजूद क्या हमें प्रेडिक्ट कर सकते हैं एंटीनेटली क्या what is the postnatal or how the kidneys are going to behave and function in the postnatal period. So how do you identify the kidneys? Is this that we see the kidneys in the renal fossa, and then we try to identify the renal pelvis, meaning thereby that the basic function and the premise of the kidneys is to filter out the blood and to make some urine, which is very classical for the kidneys only. And so renal pelvis can be identified. Then third is the renal artery. So the arterial supply can be multiple, can be ectopic, can be aberrant, and similarly there could be multiple arterial supply both to the adrenals as well as to the kidneys. Okay, so many a times this is not a pathognomic, and this might even lead to some false positive diagnosis of a missing kidney, right? And then the kidneys, they can be in the renal fossa, they can be anterior to the spine, they can be ectopic, they can be cross fused, right? So this is how the different position of the kidney they might be. But as we move on, meaning thereby that at the level 2 or at 20 weeks we try to identify whether the kidneys are present or absent. But as we move on further into a late second and early third trimester, we try to identify how the kidneys are being shaped, meaning thereby that we do have a different echogenicity in the cortex and into the medulla, so which is called as a corticomedullary differentiation. So this appears because of the differential position of the glomeruli and the loop and the PCT and DCT both in the cortex and to the medulla, and therefore there is a differential sort of an echogenicity which is called as a corticomedullary differentiation, and which is very important so as to identify and so as to see that the kidneys are functioning and shall function absolutely great in the postnatal period, right? So आज एक कोई केस है in which we had identified the slightly deviated positions of both the kidneys and the loss of corticomedullary differentiation in both the kidneys. So how those kidneys they had behaved in the postnatal period, वो मैं आज आपको दिखा देता हूँ. So this is one case in which we are focusing on to the kidneys, right? So it is difficult to see that the kidneys are there, but as you can see that the kidneys is there and there is hardly any corticomedullary differentiation, right? So it was difficult for us to really identify and to delineate those kidneys. So this is one of the kidneys, and then the second kidney is there. So similar finding with this loss of CMD, corticomedullary differentiation. It is lying anterior to the spine, right? So they are not exactly cross fused kidneys, but the differentiation is not that great, right? So meaning thereby that it was difficult to identify antenatally those kidneys. Then this is the postnatal CT of this patient, of this baby, those who are delivered, right? And then we can identify this small mass with a loss of CMD, corticomedullary differentiation, right? And then we had identified and then done a DTPA scan, and then we identified that both the kidneys they were there and they were functioning. So this is that DTPA scan, so in which we could delineate that both the kidneys and both the kidneys are there, right? But then they're anterior, they are not outrightly ectopic. So this is the similar CT in the postnatal period, but the complaints is of a decreased GFR, right? So meaning thereby that this shows a loss of corticomedullary differentiation. So there could be a lot of factors those might affect the functioning of the kidneys in the postnatal period. We try to identify antenatally. So there could be an ARPKD, ADPKD, there could be an MCKD, and whenever we do have an lower urinary tract obstruction, which we call as a LUTO, so because of the back pressure we can have some sort of an mesangial sclerosis happening in the kidneys, and therefore that might affect the functioning of the kidneys. But the second thing is this, that the corticomedullary differentiation is of paramount importance, and but then that is progressive, meaning thereby at 20 weeks it is really difficult to identify and to say that whether the cortex and the medulla they are being differentiated into each other. But in the late second and the early third trimester, definitely we can identify the corticomedullary differentiation, which is a significant finding so as to delineate and so as to identify how the kidneys are going to function in the postnatal period, right? So loss of CMD in the antenatal period, it has been delineated Similarly, in a loss of GFR in the postnatal period, and the postnatal CT also shows the similar findings, right? So this becomes an important point, so as to ascertain, so as to identify, so as to pick them up, and to delineate and to identify how the antenatal kidneys identified in an antenatal womb at 28 weeks, how the kidneys are going to behave and function in the postnatal period, right? Thank you very much for your patient listening.